Hello, this is Dr. Mandy, and I want to go over a case study to demonstrate that oxalate-related issues are complicated and not just as simple as embarking on a low oxalate diet and thinking that that's going to solve the problem. It's not. And I'm going to show you why by demonstrating how metabolic imbalances along with your genetics can actually be contributing to your oxalate problem, even more so than the diet. Not to say the diet is not contributing, of course it is, but many people, such as myself, did not get better on the low oxalate diet. And I want to show you why. Here's a very simple diagram of oxalate metabolism. Obviously, it's definitely more complicated than this, but this kind of gives you a little bit of insight as to what could happen when there is metabolic dysfunction along with genetic weakness. As you can see here on the bottom, we have the contribution from diet and from yeast as well on this side, diet. So obviously diet does play a part as well as ethylene glycol. So please do not take Miralax because that can contribute to oxalates. We have these two enzymes. I did circle one because that's the one I'm going to focus on today. And we have protein that can unfortunately convert to oxalates and in this indirect pathway, collagen as well, which protein contains some. So don't eat gelatin if you have an oxalate issue. And then we have protein coming in this way, and glycine can unfortunately shunt into oxalates as well. And vice versa, we can have a shunting of glyoxylate to oxalate without it going to glycine in the absence of B6 or genetic weakness. Now, here is an organic acids down here. This is from the NutriEval. It does show you the three different types of oxalate markers. In this case, this person had high levels of glyceric, which indicates that there may be some weakness on this arm. Now, you can also have high levels of oxalic acid. And oftentimes when that level is high, it looks like this. So this person, which actually would match this case study a little bit better, has elevations in mold and yeast, which therefore you can see that as a result of the yeast contribution and the mold, we have elevations of oxalic acid that could also be due to diet, and then also the glyceric, which is probably coming from the pathway up here with the vitamin B6 deficiency, and of course, then a little bit borderline of glycolic acid, which also involves vitamin B1 thiamine, which I'll describe further. Now, also when we have oxidative stress and low levels of glutathione and other antioxidants, this can also push this pathway as well. It does push this glyoxylate pathway. So that's why I really love this test, because it gives me some indication of where support is needed to quiet down this process. So we have here pyroglutamic acid. Yes, it's normal, but it's on the higher end of things. So that means there could be some glutathione need. And then obviously here, there's low glutathione. So this person is desperate need of some antioxidants. Also, this person has elevations in, while lipid peroxidation actually looks good, there are instances when it looks like this. You can see this person has elevations in lipid peroxidation, which means that there's definitely some oxidative stress that's causing that to occur on the level of the cell membrane. And now in this person up here, there is the DNA damage marker is trending up, but it's not into the yellow or the red, but it's definitely showing height. Whereas this one down here is low. So that's a good sign that the oxidative stress or inflammation hasn't gotten down to the level of damaging DNA. Now here's where things get a little funky. We have to take a look at our blood sugar metabolism. Things such as your A1C, which when it's too low, it could indicate that there may be some hypoglycemia. Fasting blood sugar obviously is something that people do. If it's too low, they can indicate some hypoglycemia. And then there is lactate dehydrogenase. Lactate dehydrogenase is a very, very important one to take into consideration. Why? It is found in all cells of your body, and it's involved in the conversion of pyruvate to lactate using NAD. So that comes from niacin. Okay, so it does involve that process. Also, B1 is often also involved in this too. However, this is purely substrate driven. So when this level is down, there's really no cofactor in LDH. All I'm saying is if there's a vitamin B1 deficiency, there could be some impairments in this whole pyruvate conversion. And oftentimes then that means low pyruvate levels, which can be shown here. I can show that up here. All right, so here's what that would look like. So if in the absence of vitamin B1, obviously there's other factors as well, but primarily in your Bs, B1's a strong one here, you may see low levels of this. And that can drive down LDH because basically it's all substrate driven. It's responding to the levels of pyruvate so that it can actually be utilized properly. And if pyruvate levels are low, then you can see why lactate dehydrogenase would be low, and then you would have more likely to have symptoms of low blood sugar, glycemia, hypoglycemia. Now, there's other reasons why this can happen. You may not be a B1 deficient person. You might just have glycolysis inhibited, and that could be happening if you're ketogenic. So ketogenic people who do ketogenic diets tend to have low glucose because they're not consuming it. And glycolysis can also be inhibited if there's a lot of oxalates, because oxalates can impair that on the level of the pancreas. It can impair the pancreatic function, but it can actually impair the glycolytic pathway. So anyway, if nucleus does not need pyruvate as much, it won't need as much lactate dehydrogenase, and that can also be a sign that there's something wonky going on with blood sugar and hence oxalate metabolism. Now, there's other markers as well I didn't talk about that I can see if I'm doing the testing. Transketolase is one of them, not on the NutrEval, unfortunately, it'd be a different test. And then there's the branched chain keto acids, alpha ketoglutarate, all of that. If those enzymes are impaired, there can be some thiamine deficiency. So I can see that here on this test, the NutrEval. And then also glutathione levels, as I showed you earlier, is low, and that can also impair transketolase, which is necessary, because it drives down, low transketolase actually drives down NADPH, and NADPH is used as a cofactor for glutathione. So low glutathione can be a sign there. Riboflavin is also involved. And many people are low in riboflavin, as you can see with glutaric acid and isovaleric glycine. Some of that can be driven by dysbiosis, but nevertheless, these people need riboflavin. Riboflavin is very important. It is a cofactor for GSR, the glutathione disulfide reductase. And also vitamin C is also needed to regenerate glutathione. And I know a lot of people are low in that. So antioxidants are really important. Obviously, you can't do a lot of vitamin C either, though, because of this oxalate problem. So it must be done carefully. And I do put a little bit of it in camu in the Vicon for that very reason. So the glutathione is driving up this the glutathione need can drive up this 8-OHDG because its poor detoxification of glyoxal and methylglyoxal can lead to increased carcinogenic protein adducts. So it does increase your cancer risk. So be careful with that. So then B6 deficiency is really what's the most important thing to think about here. This particular enzyme up here, alanine glyoxylate aminotransferase, is used for this pathway, and many people who have polymorphisms in that, it would look like this. Okay, so that person here has that, and this really needs high levels of vitamin B6. So now we can measure that with xanthoranic acid on the NutrEval. So if that's low, obviously that's going to be contributing to it. But then there's other markers as well that give insight as to B6 status. So many people here who have this will need additional B6 beyond what the RDA is. Now, let me also bring to your attention, I had mentioned that the yeast and fungal markers are important. So you can see here that this person also has elevated fungal markers for the mycotoxin. This is Aspergillus. This can be contributing to oxalates as well. And then there's also glyphosate. So this particular person has a polymorphism in PON1, which is used for glyphosate detoxification. And it's no surprise their glyphosate levels are also elevated. Here you can see it's just below the 75th percentile. Glyphosate can also drive up oxalates. You can see it's a lot more than diet. They've got endogenous production. They've got the glyphosate contribution. They've got the yeast contribution or the mold contribution. And then there's the metabolic contribution. And obviously, so you see that they are measured high on the NutrEval. It doesn't always show up that way, but this person does. They have need for antioxidants, which could be driving it up as well. And then the B vitamin deficiency, the riboflavin, and the B6. And then you can see that obviously there's some blood sugar dysregulation here with the carbohydrate metabolism. And the final piece of that is copper. I should be able to mention that as well, because it is a very important thing to be aware of. It's very important to know your copper status. So you really should be checking copper. You should be checking iron and ceruloplasmin because they are interrelated. Free copper is toxic. Okay, so that's why when we do the hair test and I do some assessments and evaluations to find out if there's potential free copper or copper toxicity. I see it with anyone who's taking birth control pills or anyone who's actually has estrogen dominance. We do see this. Unfortunately, it has to be bound to a protein called ceruloplasmin, and oftentimes that value can be low, which may indicate that there may be some free copper, especially when it's high like this. Now, the problem here is that and you must also have copper pipes in your home and acidic water. So all of that can dissolve the copper and you can be consuming it. High copper causes you to degrade your vitamin C. And this is a problem with forming extra oxalates because it means that even if you take high doses of vitamin C, it may not be used because the copper is degrading it. Now, how will you know? There are some people will say that your color of the blood is green with people who have high copper. I've never actually seen it, but oftentimes if you've been on birth control pills, chances are you have this problem and you will have estrogen issues as well. There is a copper zinc profile that Great Plains Lab can also do. And then some people with pyroluria also have zinc and B6 deficiency, so that's a whole nother topic of conversation. And the high free levels of copper, the unbound copper, can chelate oxalates and deposit that into the tissue. Please, please, please do not take high doses of vitamin C if you're found to have oxalate issues, because too much vitamin C can be broken down into form dehydroascorbate, DHA, and then oxalates. So anything over 250 milligrams is absolutely dangerous. And then, of course, there is this problem with the vitamin C chelation when there is copper issues as well. Also, when you have low zinc, they do balance each other out. This person obviously can use a little zinc to help drive down the copper, but there's other things that we do with mineral balancing to bring that down. A little molybdenum will help chelate it, but be careful that there is something known as copper dumping. Last thing to be aware of is take a look at your liver enzymes, ALT, AST, they are B6 dependent. So that's another clue that there's a B6 deficiency if you have lower levels of ALT and AST. Again, B6 is really important for this AGXT enzyme. And B6 is important because it will take alanine or serine into the direction that relieves the body from a buildup of glyoxylate and helps to keep glyoxylate from turning into oxalate again. So glyoxylate in the presence of B6 can go down this pathway as opposed to shunting down and becoming oxalates. So there you have it. This is why I tell you, test, don't guess. When you guess, you're really playing games with your body. You don't know what you're doing, and you end up actually hurting yourself. So it's really important to take a look inside what's going on metabolically and address the imbalances from that point. And your ability to resolve this problem is more effective in that manner. So I hope you enjoyed that little summary and appreciate the role that clinicians like myself have when it comes to running certain labs and peeking inside and trying to unravel the biochemical mess that you're in and trying to restore homeostasis. Thank you.